Understanding key medications is crucial for nursing students and healthcare professionals. In this video, we break down 20 essential drugs, their uses, side effects, and important nursing considerations. Warfarin, also known as Coumadin, is pronounced warfarin. It is used as an anticoagulant or blood thinner to prevent blood clots. When administering warfarin, it's important to limit foods high in vitamin K, such as spinach, as they can decrease its effectiveness. Regularly monitor INR levels. Side effects may include bleeding, bruising, and nausea. Avoid NSAIDs, aspirin, and alcohol due to increased bleeding risk. Levothyroxine, commonly known as Synthroid, is pronounced levothyroxine. It is used as a thyroid hormone replacement for hypothyroidism. For better absorption, it should be taken in the morning on an empty stomach. Be aware of side effects that mimic hyperthyroid symptoms such as tachycardia, weight loss, and insomnia. To ensure proper absorption, avoid calcium, iron, and antacids within 4 hours of taking the medication. Furosemide or Lasix is pronounced furosemide. It is a loop diuretic used to treat fluid overload conditions like heart failure and hypertension. Monitor for hypokalemia or low potassium levels, and encourage the intake of potassium-rich foods like bananas and potatoes. Side effects can include dizziness, dehydration, and electrolyte imbalance. Be cautious as it increases the risk of digoxin toxicity due to potassium loss. Morphine, pronounced morphine. It's an opioid analgesic used for severe pain. When administering morphine, it's crucial to monitor the patient's respiratory rate due to the risk of respiratory depression. Common side effects include sedation, constipation, nausea, and hypotension. It's important to avoid alcohol and other central nervous system depressants as they can increase the risk of sedation. Digoxin, also known as Lanaxin and pronounced digoxin. This medication is a cardiac glycoside used for heart failure and atrial fibrillation. Nurses should watch for signs of toxicity, such as nausea, blurred vision, and bradycardia. Side effects can include fatigue, weakness, and yellow-green vision changes. Be aware that hypokalemia, often caused by diuretics, increases the risk of digoxin toxicity. Epinephrine, also known as adrenaline and pronounced epinephrine. This is the first-line treatment for anaphylaxis because it causes vasoconstriction and bronchodilation. For anaphylaxis, it's given via intramuscular injection, and for cardiac arrest, it's administered intravenously. Side effects may include tachycardia, hypertension, and anxiety. Use epinephrine cautiously with beta blockers, as they may reduce its effectiveness. Metformin, also known as glucophage, is pronounced metformin. It is primarily used as a first-line medication for type 2 diabetes. When administering metformin, it's important to monitor for lactic acidosis. Additionally, do not use it with contrast dye due to the risk of kidney damage. Some common side effects include gastrointestinal upset, diarrhea, and weight loss. Lastly, be aware that alcohol increases the risk of lactic acidosis. Lisinopril, known by the brand name Prinavil, is pronounced lisinopril. It is an ACE inhibitor used for treating hypertension and heart failure. Nurses should watch for signs of angioedema, such as swelling of the face or lips, and a dry cough. It's also crucial to monitor potassium levels. Side effects may include hypotension and dizziness. Patients should avoid potassium supplements due to the risk of hyperkalemia. Heparin, pronounced heparin, is an anticoagulant used to prevent blood clots. When administering heparin, it's essential to monitor for any signs of bleeding. Use the PTT or partial thromboplastin time for monitoring heparin levels. Common side effects include bruising and hemorrhage. Patients should avoid NSAIDs and aspirin, as these can increase the risk of bleeding. Metoprolol, also known as Lopressor, is pronounced metoprolol. It is a beta blocker that reduces blood pressure and heart rate. As for nursing considerations, do not stop this medication abruptly as it can cause rebound hypertension. Some common side effects include fatigue, bradycardia, and hypotension. And, a word of caution, it can interact with insulin, masking hypoglycemia symptoms. Nitroglycerin or nitrostat is pronounced nitroglycerin. It is a vasodilator used for angina, which is chest pain. When taking this medication, it is important to sit down to prevent hypotension. Side effects may include headache, dizziness, and flushing. Also avoid sildenafil, commonly known as Viagra, due to the risk of severe hypotension. Albuterol, also known as Ventolin, is pronounced albuterol. It is a bronchodilator used for asthma. A key nursing consideration is that it can cause tachycardia, so use it before inhaled steroids. Common side effects are tremors, palpitations, and nervousness. And be cautious with beta blockers, as they can reduce the effectiveness of albuterol. Insulin Lispro, also known as Humalog, is a rapid-acting insulin. It's important to take it right before meals to prevent hypoglycemia. Be aware of potential side effects like hypoglycemia and weight gain, and keep in mind that beta blockers can mask hypoglycemia symptoms. Ibuprofen, commonly known by the brand names Advil or Motrin, is an NSAID used for pain and inflammation. Nursing considerations include avoiding its use in patients with peptic ulcer disease, as it can cause gastrointestinal bleeding. Side effects may include stomach pain and kidney damage. Additionally, it increases the risk of bleeding when taken with anticoagulants. Phenytoin or Dilantin is an anticonvulsant used for seizures. One common side effect is gingival hyperplasia, so it's important to monitor drug levels regularly. Other side effects include drowsiness, ataxia, and rash. Also, be aware that phenytoin can decrease the effectiveness of oral contraceptives. Potassium chloride, also known as KCl, is pronounced potassium chloride. It's used to treat low potassium levels. Now, one important thing to remember is never push it intravenously. Instead, it should be infused slowly while monitoring the heart rhythm. Some side effects to be aware of include hyperkalemia and cardiac arrhythmias. And, oh, by the way, ACE inhibitors can increase the risk of hyperkalemia. Ondansetron, also known as Zofran, is an anti-nausea medication. When administering this drug, it's important to monitor for a prolonged QT interval. Common side effects include headache and constipation. Additionally, be aware that it can increase the risk of serotonin syndrome when taken with SSRIs. Prednisone is a corticosteroid used to reduce inflammation. It's crucial not to stop this medication suddenly. It must be tapered to prevent adrenal insufficiency. Side effects can include weight gain, hyperglycemia, and osteoporosis. Also, it can increase blood sugar levels, so caution is needed in diabetic patients. Rifampin, marketed as Rifidin, is an antibiotic used for treating tuberculosis. A notable nursing consideration is that it causes orange-colored urine, sweat, and tears. Side effects may include hepatotoxicity and nausea. It's also important to note that rifampin decreases the effectiveness of oral contraceptives. Vancomycin, known by the brand name Vancomycin, is an antibiotic used for serious bacterial infections. Nurses should monitor kidney function and hearing due to the risks of nephrotoxicity and ototoxicity. Side effects can include red man syndrome, which necessitates slow infusion and hypotension. Additionally, it increases the risk of nephrotoxicity when used with other nephrotoxic drugs, such as aminoglycosides.